Meantime, tonight, concerns about flurona. This term refers to someone getting infected with both the flu and COVID at the same time. Tonight, we've learned of one case here in San Antonio from last year, and there are plenty of people getting infected with one or the other. Eyewitness News reporter Alicia Nieves joins us in studio tonight with the plea from doctors.
Sharon, we're coming off a historically low flu season last year, and nationwide we had the lowest flu numbers since we began documenting them in the early 2000s. This was before the COVID vaccine, and many safety protocols remained in place, with many of us still at home. Doctors fear, though, this season, if we don't take action, flu patients could be the tipping point for our hospitals.
Overwhelmingly right now, it's still the COVID that we're being taxed with, but flu will just make it worse.
It's the time of year when flu season usually picks up.
Flu will be here for the next several months.
With cases inching higher nationwide, doctors with Christus Santa Rosa predict a bigger flu season this year in San Antonio.
As we've gotten back to normal, there is going to be this kind of pent-up demand, if you will, for these other viruses to explode as well.
Dr. Hankins says the hard part now is telling the difference between the flu and the new COVID variant.
It is getting more confusing and it's tough. The symptomatology has always had an overlap, but with the Omicron variant, it is even greater.
Flu cases are on the rise at Christus Santa Rosa and at University Health.
Last week, we saw 62 cases of flu, which is up from the week before where we saw 48 cases.
Dr. Bowling revealed today the rare double infection of COVID and the flu, called flurona, hit San Antonio late last summer.
We had a case back in August of a person that was co-infected with influenza and COVID. I think this is going to be a lot more common.
If hospitals become overwhelmed with COVID and the flu, doctors predict other patients may run into problems getting immediate care. On top of that, they say the supply chain problem could hit hospitals next.
They work really hard to maintain all the supplies they need, but when you start hitting larger and larger numbers, it becomes more and more challenging to have the supplies, the therapeutics, the medicines, the things that you need to provide the best quality care for our patients.
So what can we do about this? Doctors say keep wearing a mask, avoid crowded events, and get vaccinated. The good news is we're seeing flu A as the predominant strain of the virus that's circulating. Doctors say it matches pretty well with what's in the flu shot. Remember, it's safe to get the COVID and the flu vaccine at the same time.